Well, hi, everyone. I'm Daniel Williams, host of the MGMA Insights Podcast. In today's episode, we are previewing a session from the 2025 MGMA Leaders Conference. It's part of a series. We really want to bring awareness to that conference. It's going to be in Orlando, September 28th through October 2nd. We're really excited about that. All right, and we are joined today by Dr. Alpesh Amin. Dr. Amin is Associate Dean for Clinical Transformation at UCI Health in California. And Dr. Amin will share how to leverage digital health and virtual care templates to optimize ambulatory space. So first of all, Dr. Amin, welcome to the show.
Well, thank you. It's a pleasure to be here.
Yeah, it's so good to have you. We were talking a little bit offline. I know that you've been busy, I've been busy, but we worked out our schedules, and I love it that we're having an opportunity to talk to you. So first of all, just tell us a little bit about your background in healthcare and how you wound up at UCI Health. Any highlights you might want to share with us?
Well, thank you. You know, I started my career kind of having had some experience in the startup world in both bio and tech. Came to UCI for training. Started our hospital medicine program and division here. Served as chief of general internal medicine, and then became vice chair for clinical quality and ultimately chair of medicine at UC Irvine, where I spent 3 terms or 16 years doing that. And now I'm associate dean for clinical transformation. Also do a lot of real world evidence, both to drive better healthcare delivery, technology in healthcare, as well as both precision health and population health. And how do you make things better for people, right? As they're accessing healthcare is really important. So I kind of bring the worlds of have a background in engineering and in business and obviously in medicine. So I kind of try to bring those 3 worlds together to do public good if I can.
That is wonderful. And it dawned on me that you're at UC Irvine when you mentioned that. And I had read that earlier as well. Back from 2000 to 2003, I was working in a building just across the street from the campus.
Wow.
I was in the media at the time. I was working at the Orange County Business Journal, writing about real estate there. And I used to sneak over on my lunch breaks to that In-N-Out burger place that's right there. And it was always about it took me the entire lunch break to just sit in the line and get my burger and go back to my desk. But it was worth it. So it was worth it.
Yeah, I have a lot of international friends. When they come into town, believe it or not, they like going to nice restaurants, but they always want to stop off at In-N-Out Burger at some point during their trip.
Well, it is a unique sort of place, but that is so cool. So, in reading about your session, you really are at the Leaders Conference. You're going to be focusing on ambulatory space optimization. Just in a general way, just define that. What does ambulatory space optimization mean to you?
Well, for me, it means it means access to care.
Okay.
Right. How do we ultimately bricks and mortars is limited. You can't keep building bricks and mortars to achieve opportunity in terms of access to care. And as patients continue to evolve and age and have challenges, there may be other ways that they need access to care, right? And as we move to more real-time care delivery, you need, which facilitates access to care, there's ways that we need to think about doing things differently, right? And so that could be the use of telehealth and technology. That could be having care delivered at home. So there's a lot of different using digital health, empower. And there's this idea of empowerment that also patients, as they feel more empowered to help in their care delivery, you hopefully will see them own it more, continue to be engaged in it. And we know that engaged, empowered patients generally will do better in terms of their quality and outcome over a long period of time, especially for things like chronic illness. So the ambulatory setting is a very unique setting in the sense that you have some control over the ability to optimize. And that includes everything from templates to bricks and mortars to space efficiency to, working at the scope of your license when you have a multidisciplinary team involved, to thinking out of the box in terms of delivering care where the patient may not be actually in front of you at that moment in time.
Yeah, those are some great points there. So in reading about your presentation and your notes there, you noticed some challenges when you got to UCI Health. What were you seeing there? What stood out to you that went, okay, we do need to make a transformation here. We need to adopt some of these new practices if we really want to meet patients where they are?
So in some sense, UCI Health has also been on the forefront of thinking out of the box and using, we've developed over the years, we've developed tools that will help in terms of patient care delivery, where it may be non-patient facing, or like e-consults in the ambulatory space. And we've had great success with that. We have a business day turnaround on e-consults. Think about you trying to get in to see a specialist, how many days or weeks it takes you to actually get an appointment. So e-consults, one business day is phenomenal. And 85% or so of those consults are successful, right? So patients can be at home while that actually happens. Telehealth and the versions of telehealth, we utilize that. Then we could talk more about the kind of the COVID experience that we had, but that also allowed us to think about bringing what we call business continuity back in, right? So as COVID was getting more and more control, one of the things that we needed to do was rebuild our patient access in the ambulatory setting. So at that time, I was chair of medicine, and I co-chaired a process with one of our ambulatory directors, and it was we were asked to get to 120% of budget in a matter of a couple of months, and we actually did it within a month, right? So it was, and that was transformative in terms of the process and how we rolled it out. But I think if we kind of look at this, we're never going to have enough space for all the physicians and APP, nurse practitioners or PAs to practice in. So we need to think about how to incorporate technology in terms of the delivery that allows for patients to feel continuously connected. I'll repeat that, continuously connected with the health system that they're engaged with.
Yeah, I appreciate that. And then that leads right into my next question. And I really wanted to ask you about that. In reading about y'all's case study, you put together this digital transformation. You were in the notes, it says you were able to expand clinical teams, but you did that without having to build new physical space. So talk about that expansion and what innovation you did, or what did you do so you didn't have to add on to the space that you had already?
So I think it was multifactorial that we did. We had patients that were discharged from the hospital with COVID. We actually implemented a remote monitoring system where we were connecting into patients, able to measure their oxygenation, measure certain vital signs of the patient. Certainly they had to know how to use a smartphone or smart device in order to do that. But those that could, and we actually published an article that showed through remote monitoring with well-developed criteria, workflows, and technology and education, we were able to drop the length of stay for patients in the hospital by a day while not adversely affecting our readmissions or visits to the emergency department. So that was highly successful, but it also meant that we were able to keep patients at home and provide care to them, that they didn't have to wrap around to come back for an ambulatory visit. We could have that ambulatory visit available for other patients that needed it. Telehealth, your traditional over Zoom or whatever platform is being used. We did a lot of that kind of work with patients in order to facilitate care delivery. We had developed some digital online scheduling platforms for patients. We made labs and other results available online and accessible to patients through our MyChart systems. We even had, in order to prove efficiency, when a patient showed up at UCI Health, they would show up in a parking lot, and they were able to connect in with the nurse who would come out and do the intake while they were in the parking lot, in order to keep both social distancing occurring as well as allow patients to allow the intake. It's a little bit of history and other thing getting done. I mean, other industries have done some of these things, right? You think about drive-throughs when patients you talked about in and out earlier. But if there wasn't the drive-through, think about how long the lines would be without drive-throughs, right? So you think about, but then there's new technology that you need to have in order to be able to facilitate that process. As long as we were able to register the patient at the appropriate site, which we were able to do, we could utilize a virtual platform. It could be patients at home and while, the physician was in their office, academic office, so that they weren't in the clinic, so somebody else could use the clinic, right? And so there was different strategies that we used. And as I mentioned earlier, our outcomes were just tremendous as we engaged everybody in the process.
All right. So you are giving us some great examples around that pandemic time and some of the innovations that were being implemented then. As we're seeing, technology is continuing to evolve. Healthcare is continuing to evolve in the way they meet with patients, whether it's in person or virtually. So talk about that. How are you currently managing workflows and those faculty expectations, your staff, to maintain a high quality experience? You bring in that from both sides of it. So both the patient and the employees and the staff feel good about those interactions and the care that's being delivered.
Yeah, it's an interesting thing, right? If you're going to go play for a national football team or a basketball team, or you're going to go to the Olympics or whatever, think about the training that's done from a team perspective, pre-training and scrimmaging and all that stuff. It's done months in advance before you start, real-time play is actually occurring. In healthcare, we don't do that, right? In healthcare, we throw people into the sandbox and say, figure it out while you're doing what you're supposed to be doing in terms of healthcare. I think as we've continued to evolve, we kind of set clearer and clearer expectations of different people's roles. We've kind of helped people understand that healthcare is a team sport, not an individual sport, and, how to delegate certain responsibilities. Always in any team, there's going to be kind of the captain of the ship, right? But besides that, then the rest of the team is supporting the process, and everybody has an important role in that process. And so we've kind of encouraged that. We are a big believer in the multidisciplinary care. So, the doctor shouldn't have to spend their time trying to educate about social work needs or dietary needs or whatever. The practice should have those types of resources available. Now, they also don't actually have to be all on site either, right? They could be referrals, they could be telehealth, they could be go down the street and somebody will be able to see you. I mean, there's all kinds of different variations of that. But having access for patients to the multidisciplinary team, I think, is really, really important. And then the communication between the multidisciplinary team is important. So we're using things like Teams and Epic Chat and other tools to help facilitate the communication between the multidisciplinary team around a single patient, so that critical information is not lost, right? The more information I know, the better I can make a decision about the patient when I'm being asked to step to the plate, right? And if I can hand off that information like a baton to the next person, then they're stepping up to the plate in an easy way. If I can transmit that information, they can do their job better too, right? And that creates camaraderie, that creates an opportunity for people, but you need the tools to help facilitate that.
Right. I want to ask a question about the patients themselves. Have y'all done studies, any research to get a feel for how the patients have responded to y'all's transformation and the way they're being treated?
Yeah, we've done different types of research. Where do patients want to get? Do they want to use digital health, or do they want to go to a traditional ED, urgent care, office visit to get their care delivered, right? And what are the demographics of the types of patients that want it one way or the other? What's the cost associated with doing it one way or the other, right? Let's do our patients and using technology to facilitate their healthcare. And, we've been actually quite nicely surprised that actually, maybe there was a time when you might have thought that the younger generation was more astute to using tech, and the more elderly generation would be less, interested in using it. But I think our studies and research have shown that more and more people, even as they age, are utilizing tech to facilitate their healthcare delivery. And whether it is just convenience factor, I don't want to have to leave my house to go and get get my information or to talk to somebody, or whether it is something to do, at home using devices and tech to allow for it. Of course, there's also, you don't want people practicing medicine on their own. And I actually think the world of AI is going to change a lot, is going to impact this in a great way. And, we should be on the forefront of trying to figure out best practices in the utilization of AI for better and more efficient healthcare delivery that optimizes quality.
Yeah. Fine. Thank you so much for that final question then. For any of our MGMA listeners who are considering implementing these practices into their clinic, their system, what's some advice, what's some first steps that you'd want to recommend to them?
Well, my first thing is be open to the fact that there could be different ways of doing things, right? And to create the team of folks that will work with you. It doesn't have to be a big team, but a team to say, to ask the question, how can I do it differently to meet my goals? It could be a 10% growth, 20% growth in your practice. It could be easier accessibility of patients to healthcare delivery or to continuity. It could be how to ensure your no-show rate is as low as it can be, right? So there's a lot of different, or how do you avoid urgent cares and EDs, which are more expensive than office visits and home visits or home care in some sense. So you can think about your goals. So I would set certain goals, make sure the entire team knows what goals you're trying to achieve. You don't have to hit all the goals in 1 year. This can be an evolutionary process of how you build on those goals to get there. But I think it needs to lead to accessibility. It needs to be customer friendly or patient friendly. And it needs to be coworker friendly in terms of how you are building systems to drive better delivery in healthcare. And I think it starts with identifying your goals, identifying your team, getting everybody on the same page in terms of what you're trying to accomplish, and then boldly going to accomplish that, right? And do an iterative process of understanding where gaps are every step of the way and close those gaps and and hit your successes, celebrate your successes and your wins as you're continuing to move forward. And at the end of the day, the patients are the ones that will win, and that's what we want.
Love it. All right. Well, Dr. Amin, I want to thank you so much for joining us today on the MGMA podcast.
Well, it was my pleasure, and thank you for including me.
All right. So for those attending the 2025 MGMA Leaders Conference, be sure to check out Dr. Amin's session. It's titled Ambulatory Space Optimization with Digital Health Transformation. Now, I'm going to put a direct link to the event in our episode show notes. You can click right to it and read more about it and register. And hope to see y'all in Orlando, and be on the lookout for more interviews with our leaders speakers. So until then, thanks everyone for being MGMA podcast listeners.